Myoactivation is the insertion of hypodermic needles into muscles, fascia, and soft tissue with the intention of releasing these tissues from a contracted state.
When the body experiences trauma, say from an accident, work injury, or repetitive strain, the muscles respond by going into a prolonged state of contraction, causing muscle tension. This muscle tension results in poor muscle coordination and developing unergonomic muscle habits, which can ultimately lead to pain and discomfort.
In myoactivation, the doctors will start by gathering a comprehensive history of your pain dating back to childhood. They will then examine your posture and range of motion and ultimately determine where they believe most of the muscle tension is being held in your body. Once they localize this muscle tension, they will palpate to locate the more significant areas of tightness, like a knot when you are receiving a massage, and this suggests that the tissue underneath is contracted.
The doctor will then insert the needle into this tissue, stimulating a spinal cord reflex and muscle twitch, leading to lengthening of the muscle. The needle will never be left inserted for more than a second, as they are quick in and outs. You're likely to receive treatment in multiple areas of your body because oftentimes where you're experiencing the pain isn't where it's originating from.
The results of myoactivation are typically quite instantaneous, so a lot of ground can be covered in one appointment.
You may find that the treatment is uncomfortable or painful. Some people do and some people don't. It really varies depending on your muscles and your pain tolerance. Treatment is different in different areas is likely to feel different. For example, larger muscles versus smaller muscles. The sensation itself is comparable to IMS and acupuncture. However, the duration is typically less as the needles will never be left inserted.
You are likely to experience some minor bleeding and bruising at the site of needling and soreness for a few days following treatment. You may also experience some sweating, nausea, or dizziness during treatment, depending on your tolerance of needles. Sweating is quite common as the treatment stimulates a sympathetic nervous response. Less commonly, you may experience vomiting or fainting, but this is very infrequent and generally depends on whether you have a tendency for these responses. A more serious risk with any needling treatment is a pneumothorax, a puncture of the lung. However, we've never seen this and it is extremely unlikely to occur. If you go home and feel intense one-sided chest pain, that is a symptom to call us about.
Generally, people experience some soreness, achiness, and fatigue following treatment. You can get some numbness, tingling, or local skin irritation near the needle site. This usually settles out in a day or two. Give us a call if it doesn't, as we may just need to release a bit more muscle tension. You may also find that your pain changes in location and intensity. This is normal and typically a good sign, as your muscles are responding to the treatment.
The methodology differs in the way that our focus is more on anatomy and ergonomics. Rather than treating the site of pain, we aim to localize the root of your pain and treat there, as to avoid future discomfort. Our treatment also involves the use of a hollow bore needle, which is much smaller than the needles used in acupuncture or IMS. The needle will never be left inserted in your muscles or moved around. The treatment is also performed by a medical doctor.
Most patients are able to accommodate themselves to appointments. However, those with predisposed conditions or difficulties may benefit from being accompanied. If you have a long drive following treatment, we recommend breaking up the trip to avoid prolonged postures. This means pulling over every 15 to 20 minutes, getting out of your car, walking around the car, and then getting back in before resuming your drive. Additionally, we advise against biking to your appointment, as fully exerting your muscles following treatment could hinder long-lasting benefits.
For the first 3 to 5 days following treatment, we advise against doing any activities that fully exert your muscles. This means no lifting of heavy objects, working out, or exercising at your normal function. If you want to go for a walk, we ask that every 10 to 15 minutes you take a break for a minute or two before resuming your activity. If you are sitting for more than 10 to 15 minutes, adjust your posture or stand up and walk around for a minute or two before sitting back down. After the first 3 to 5 days, you can begin to engage in more activities. However, reduce the intensity down to 20% of your normal and gradually increase intensity in a stepwise manner. More information about post-treatment care is available on our website.
You're welcome to use heat or ice after treatment if it feels good for you, but for no more than 15 minutes at a time. It will not affect the outcome of treatment, but it could possibly alleviate some discomfort you may be experiencing. You may also take ibuprofen or muscle relaxant to relieve the pain if this has worked for you in the past.
Ideally, during the first 3 weeks of your initial appointments, it is best to abstain from these other modalities in order to determine whether myoactivation is beneficial for you. This way, you can learn for yourself which modality is most effective in alleviating your pain. However, if you want to continue with these other modalities, we suggest a 5-day waiting period after treatment before engaging in these therapies. For physio and chiro, ensure that you are engaging at a lighter load and inform the practitioner of the treatment you have received. For massage, avoid any deep tissue massage and also inform the practitioner of the areas where you received treatment.
Everyone responds to treatment differently. On average, patients require 3 to 8 treatments. However, some need less and some require more. This will really depend on your history and severity as well as your post-treatment care.